Hi, I'm Dr. Moore, speaking to you from New Orleans, where I practice with a big group of private practice bariatric surgeons. My work is unique because I offer a spectrum of treatments for weight loss. Some patients see me just for a weight loss medication prescription. I do some fancy new things endoscopically through the mouth. And then what I've been doing the longest is laparoscopic bariatric surgery. That's where I operate with the poke holes looking at television screens, the way many people have their gallbladders taken out nowadays. The work that I do is incredibly rewarding because I get to do surgery, which surgeons think is fun, but I also get to see patients back in the office becoming healthier, and being able to cross off medical problems as they get smaller is one of the parts that makes the office most rewarding. Sometimes patients tell me they're having trouble choosing to have elective surgery, and I tell them, instead of wondering, do I want surgery, because the answer to that is no, nobody wants surgery. The question that they should be asking is this very safe surgery safer than doing nothing? Statistics show that laparoscopic bariatric surgery in experienced hands is safer than having your gallbladder removed. And gallbladder surgery is so common, people act like that's no big deal. But laparoscopic bariatric surgery in experienced hands is very, very safe. Obesity treatment starts with a prescription or an endoscopic treatment or surgery, but it's actually a very long process. The 21st century view of this in medicine is that it's a chronic disease, and a chronic disease needs years of treatment. It's important for you to have a team that you feel comfortable seeing, and seeing as frequently as you need to, year after year. We're trying to view weight loss as a chronic disease nowadays, and a chronic disease needs years of treatment. So we don't intervene once with a surgery or a prescription or an endoscopic treatment and then tell you goodbye like you might with someone that has an appendectomy, for example. As a result, it's important for you to be with a multidisciplinary team that you feel very comfortable calling the office, comfortable coming in for visits, and being overseen for years as you get healthier going forward. I'm a lifelong learner and always curious about what new things could be arriving that would help with weight loss. You can tell from the scope of my practice that what I do now is very different than what I did 5 years ago. I think this is advantageous for patients because you can count on me to be up to date on how best to take care of you going forward. When you're on a weight loss journey, it's not a brief thing. It's more than 1 year, and you need to have a team that will evolve with you and learn new things that you feel comfortable reaching out to for your needed follow-up in the future. Louisiana is a wonderful place to live, but as an obesity treatment expert, it hurts my heart that we have such a high prevalence of people that need help with weight loss and poor access to treatment. And when we in my specialty refer to access to care, we're talking about coverage for weight loss medications, coverage for endoscopic or surgical therapies to help people lose weight. And Louisiana is unfortunately a bad combination of a lot of people that need help and very few that have access to treatment. One of the most interesting things that's happening in social media is the rise of very powerful patient voices, which I think has been charming and helpful, because when physicians talk about the need for access to care, we're considered biased because patients think that we're just marketing for more business. So a patient's voice can be particularly powerful.